Hello, hello, beautiful soul. It is so wonderful to connect with you here live on Facebook, LinkedIn, and YouTube. Thank you for tuning in. I am Dr. Andrea Pennington, founder of Innate Vitality, the host of the Psychedelic Curious Journal, and all around great gal who's excited to inspire you to go for the limits in your health and your vitality. Today, we're going to have a conversation with a very dear friend and colleague, Dr. Jill Stocker, and we're going to be exploring peptide therapy. Have you heard of it? Well, apparently a few of you had, because when I sent out an email to my list, I got a couple of questions. So, we are going to talk about peptide therapy, and we are going to discuss what it is, how it works, and should you try it? So, if you don't know anything about me, I am a doctor of integrative medicine, and that means that I integrate the best of ancient wisdom, Eastern traditions, along with the Western allopathic paradigm. And in the very beginning of my medical career, I was uh, fortunate enough to be the medical director and spokesperson for Discovery Health Channel. And while I was on Discovery Health, reporting the news, as well as hosting a bunch of documentaries, I had the opportunity to read hundreds of news reports in a week and bring the best of the best to our viewing audience. And one of the things that was really striking, this was okay back in the year 2000, right? 2001, 2002. And what I was finding is that there were all these studies coming out talking about how we could improve health with some very non traditional means. I'm talking mindfulness, meditation, studies around yoga impacting the brain. But in particular, I saw some studies about people in their 30s taking hormones. And that is how I discovered this field of age management medicine and hormone optimization. So while I was working on a story at Discovery Health, I ended up calling this physician, the late Dr. Alan Mintz. And he was the founder of the Cenogenics Medical Institute. And it was odd because I called him and I'm like, I want to know about this, like women taking testosterone and all this stuff. And he answered the phone. And he kind of chuckled. He's like, yeah, I bet you and me are the only physicians who answer our own phone. And it started off this relationship of me being super curious and eventually going and getting my certification in age management medicine. And it, for me, was perfect because what age management medicine really represents is preventive medicine at its best. It's not geriatric medicine where you're taking care of older people with diseases associated with aging. It is sort of like a subset of internal medicine, and it's preventing all of the age related diseases like cancer, Alzheimer's, diabetes, the list goes on. So for me, I ended up creating a concierge medical program where people would pay and spend an entire day getting a whole battery of tests, much more than your traditional doc takes. So, not just your hormones, but all other things and parameters around the body. Doing age management medicine is also what opened me up to become a sex educator, because one of the tenets of age management medicine is, we want to extend your health span, not just your lifespan. And part of living healthy means living orgasmically. Yes, even into your eighth decade of life, orgasms should be a part of life. And yeah, so it really started me on this path of looking at how can we optimize hormones, nutrition, stress management, exercise, fitness, environmental well-being so that we preserve your health across the years. And I myself found that even though I wasn't clinically hypothyroid or in growth hormone deficiency, according to the age management protocols, my doctors felt like it would be worthwhile to just have me optimized a bit. And and I did. And I remember feeling like Okay, is this cheating to have all this support? So, long and short of it is preventive medicine at its best. And in the last few years, something that's been added to our armamentarium within age management medicine and hormone optimization is peptide therapy. So we're going to get into it because my doctor, Dr. Juicy Jill Stocker, insisted that I give them a try. And I'm so grateful that last year I did it. And we're going to talk all about it. Dr. Jill Stocker, thank you for being here. So good to have you. Yes.
So great to be here. Thank you for sharing. I always hear a little bit more of your story every time we talk. And I never had the chance to meet Dr. Alan Mintz, but we actually trained at the same institute for age management medicine and hormone optimization. So we do know a lot of the same people. And I love what you said about living orgasmically, like
Yes.
the orgasm doctor herself saying that for men and for women. And I love that because people think, as we age, it's just part of getting older to have these symptoms of like not really feeling motivated, not feeling, fully ourselves, not fully alive. And I had a patient that texted me a picture of herself. She's mid 60s, a couple weeks ago, and she's living her best life. And you would never guess her age. People never guess her age. And it's not about, just what we look like or anything. It's literally living your best life. And speaking of orgasms, there is actually a peptide specific to sexual health for men and for women. And most people think of only Viagra and Cialis, and there's not really anything for women out there. There's a few new things, that's not really marketed heavily. But there's actually a peptide specific for sexual function. It's called PT141, and it works on the neurologic effect, which you speak to in your book, The Orgasm Prescription for Women. I highly recommend it, people. It's amazing. And it's for men and women to read because men need to be aware of this too. So as I mentioned, PT141 is a peptide that works on the neurologic component of orgasm because orgasm actually starts in the brain. And so most people, like I said, equate Viagra, Cialis, and some women have taken that, which is more the vascular component. And so for people that are taking that and it's not really giving them the desired effect, PT141 is something that really enhances that. And it's available in a nasal spray and a injectable, and it works differently for each person. But it's amazing. The nickname for that one happens to be the Barbie hormone,
Oh, my.
because some of the side effects of it are that it actually makes you a little bit tan. It enhances the melanotan component, melanocyte producing, which some people don't like that. Some people do. And it also helps to actually reduce your appetite. So it makes you tan, horny, and skinny. I did not claim that name. That's something that was in training, how people refer to it. But it works amazing. So I just kind of jumped right in there on the juicy orgasm train. So
And I'm here for it. I am here for it because absolutely, if we think about this in terms of how traditional Western medicine is practiced, we're still operating on decades, 50 years old recommendations in many cases, y'all. Like, I know that may sound shocking, but it's true. And so when you look at, for example, I wish I had a chart for you, but we look at things on a bell curve. When we look at studies, for example, they look at a large population to see, when are people dying? What are the hormones doing over life? And it follows this bell curve. But what Dr. Jill and I do is we know that you don't have to be all the way at one end or the other. You can be optimized. And just because most physicians are not yet practicing this way doesn't mean that we're doing anything unorthodox. But it is about recognizing that now we do live to our eighth, ninth, and 10th decades. Like that is the norm. So it's not okay for you to just say, oh, well, I'm hitting menopause, or I'm getting older, I'm 40 something. No, it doesn't mean you have to tolerate symptoms like low libido, low sex drive, vaginal dryness, lack of orgasm, or decreased intensity of orgasm. So, of course, I'm going to keep going on and on. But one thing I want to understand more about that peptide, Jill, is what is the mechanism of action? The Barbie peptide.
Oh, I mean, it works on the neurologic component of orgasm. So it stimulates, oxytocin release. Some of the peptides, they don't necessarily have the exact mechanism of action, but they know that it creates these symptom relief, which that's the thing with peptides is it doesn't necessarily move the needle with numbers. So it's actually getting away from the numbers. Most of the peptides stimulate our own production of IGF-1, which is how we measure growth hormone. But they are more for symptomatic relief and preventative relief. So the only real measurement sometimes with these peptides is subjective, which is great because we're moving away from knowing everything, but we know that it provides um, improved quality of life, vitality, and there's plenty of studies around the safety of them without, any detriment. And so a lot of times studies aren't published if things are not FDA approved, which peptides are not FDA approved. Well, some of the peptides are not FDA approved because we can't patent something that occurs naturally. But it doesn't mean that we can't use it, that it doesn't prove a benefit. It just means that big pharma won't back it and there's not a lot of money in it, but there's a lot of benefit. As you mentioned, that vitality that people can enjoy into their eighth and ninth decade of life. So again, it's non-specific as far as the neurologic benefit of it and how it affects the oxytocin release. But they're still studying all of it. They know that's safe and it provides not just symptom relief, but so much more. And the other thing that you mentioned, as far as people just kind of dealing with their symptoms. Some people don't know. Some people don't know that the symptoms that they're having or the way they're feeling is not okay, that they can feel better. Or I literally have had somebody say, like, I'm okay with the status quo.
Mm-hmm.
And when I practice, and I know that you, I know you have been a subject to this, that I have, and not forced on you, but just offered, is I offer more. Like, I want more for you. So a lot of times the conversation is like, no, I want you to be amazing, not
Yes.
just like, okay. And so a lot of times it's having that conversation of like, somebody's like, oh, ho hum, like everything's okay. And I'm like, well, that's not a ringing endorsement for your living your best life. And it's
Right.
not to say you're not going to have like the ups and downs and challenges and things like that, but you should be able to say, like, I feel amazing, and offering that to people, to advocate for themselves, to want more. It's okay to want more and to demand more from your practitioner too. Like, if they don't know about these things, which a lot of traditional doctors don't, they either will badmouth them because they don't know about it,
Yeah.
or like I did, I got curious about it. I was like, what is this stuff? Like, I want to
Yes.
learn more, and then try it out, or you can say, I don't know, but
Yeah.
I will learn more.
So I want to just tease something up for our viewing audience. So we're going to be talking about peptides. What is the name of the Barbie peptide? P something or other? What is it?
PT, PT 141.
Okay, so PT-141 we've covered. We're also going to explore oxytocin
For men
because
and
that,
women.
right, because that's also available as a nasal spray. I did want to talk about BPC-157 and sermorelin. So we'll get into some others just to give people some insights. And if you want to send us in a question, you can do that as well. Willing to explore. So since we started off talking about orgasm and you mentioned oxytocin, let's go there because that is Well, wait, I have one other thing to say.
It's fun to go there.
Yeah, it is fun to go there. But no, I have one other thing to say about what you just mentioned about wanting more. So, y'all, here's the deal. I am a naturally vivacious, spunky kind of woman. And a couple of years ago, I noticed that I needed to take naps in the afternoon, which didn't really bother me. I mean, I wake up early, I meditate, I go for a jog or do Qigong, got my kid off to school, did a little bit of work, and then usually around 2 before picking my daughter up from school back in the day, I would like to take a nap. And I was also finding that I was not waking up refreshed. And I had nothing wrong. I was still working, I was still functional, I wasn't necessarily depressed, but I just noticed a little bit, and Jill noticed that I was a little bit dipping low. And that's when you asked me, you were like, so how do you feel? And I'm like, yeah, I'm all right. And you're like, well, I don't want you to be all right. I want you to be amazing. And I was initially kind of like, well, I don't need anything, typical Dre. But I'm so grateful that I listened to you and got the full battery of tests when I was in America, and then later did the Dutch test. So I'm really grateful. I just want to let everyone know that she didn't force it on me. She advocated for my well-being, and now I am, we'll get into it, but I'm completely shredded thanks to one of the last peptides that you prescribed. We'll talk about it, but let's start off with oxytocin since we started off with orgasm.
Well, let me just add something to that. I remember you had like your own little concoction of the guarana for
Oh, yeah.
energy, and I was like, oh, what's going on, and like what supplements and everything. And so that's something that I see frequently is people buy so many supplements, from Whole Foods or just like online and things like that to treat these symptoms. And they spend so much money on them and it doesn't give them the results.
Mm,
And as you mentioned before, it's not just about helping with the symptom control, it's actually about reducing your risk for age related diseases. And so, a lot of money is spent on that nutraceutical companies and things like that, where it may not be giving you the most benefit. And when I talk to people about like, what are your goals? They're like, well, what do you mean? Like with
mm,
you? I'm like, with all of it, not just healthcare, but personal and professional. And that conversation led to you launching your own nutraceutical business,
mhm.
which is actually safe, effective, doctor recommended. Innate Vitality is the name for people that want to check it out. So it's not just about reaching those physical goals, but also like personal and professional.
Yes, absolutely. I mean, I know you've said this before in other broadcasts that I have changed your life, but you have equally changed mine, improved mine, got me revitalized on the inside, and yes, supported me in the launch of Innate Vitality along with our friend Trevor Hahn. And yeah, I mean, I feel like at the age of 51, I don't follow my weight. I don't even have a scale. I haven't owned a scale in 25 years. Um, that's a whole nother story. After treating people with eating disorders, I just don't do it. But I do know that I am now at the weight I was when I entered medical school. Can you believe
Me
that?
too.
Like, that's crazy. And I didn't try. Okay, so somebody asked in the chat about peptides for weight loss. We're going to get to it. I'm going to tell you how I lost all of my COVID weight thanks to this peptide that Jill put me on. But we did start talking about oxytocin. Let's talk about something fun and uncontroversial for a minute. So, so I love that it's in a nasal spray, and I've been sort of looking at some of the studies and people looking at efficacy of, does it really create an effect or not an effect? It seems kind of iffy, but tell me what your perspective is.
I think it's amazing. I mean, it's completely, it's, I've used it in my patients for years. When I first started with the hormone optimization, Initially was using it for women who were having difficulty achieving orgasm, or that their orgasms were kind of muffled, not as strong as they used to be, or women who used to previously be able to have multiple orgasms and now they're like barely able to have one. And so it was effective in that sense. But as both of us have aged, our whole trajectory has changed, and I want to learn more about, brain health and gut health and all of it. And I'm continuously looking into that. And so nootropics are brain enhancing medications that can be used in nasal sprays and supplements as well, that actually help with mental clarity, focus. They can reduce your risk for Alzheimer's disease, and they can also help spark creativity. And with oxytocin, because it starts in the brain, it's released when we have an orgasm, it's heart opening. Some people call it like the love hormone. Um, I have done, and you have done as well, studying into the psychedelic realm. And, I had the notion of like, well, with psychedelics, there's a lot of heart opening, mind opening consciousness blasting through all of that to elevate to our highest potentials. And I thought, well, I in particular know that I've struggled with like really having something like strong inside that like holds on and makes it hard to open up to newness and creativity and all that kind of stuff. And that has gone by the wayside. I thought, well, what if, I know I'm going to be attracting similar people, or working with similar people. And what if there was something to help them open up, rather than having to go through this like arduous process, and just, a little boost. And so, as I do, I always try things myself because I want to be able to speak from experience. And everything I do is evidence based. So I looked at the research with oxytocin specifically by itself, and then with ketamine, which is a psychedelic that I use. And it's very safe. It's used for multiple purposes. It can be used for pain relief. It can be used for social anxiety disorder. So for people that have a hard time with public speaking, which, believe it or not, I used to not be able to speak publicly until you. But the oxytocin, I have found to also work as a nootropic, helps to expand consciousness and also helps to foster creativity, in addition to enhancing that lovey feeling, heart opening, and orgasm. So it is something that, oxytocin is free when you get it yourself. So you can have that with a partner or with self-stimulation. So you can have those benefits. For people, wondering where they get this elsewhere, I use a specific compounding pharmacy that everything is bioidentical. So it's exactly like our body. It's available in a nasal spray, which I prefer. It tends to have a little more direct effect, and also a sublingual troche that dissolves. Not quite the same effect for heart opening, consciousness, creativity opening, but good for pain relief. So there's a lot of different uses for it.
Super interesting. Well, again, I'm going to say, why do you think I need that, Jill? I mean, I'm already like super creative. My heart is open. I'm in love. And the other way we can get oxytocin is by having a pet.
Yes.
When we are cuddling with a pet, that also increases oxytocin. But I digress. Well, everyone, I will report back. I just got back from America where I got my shipment that included the oxytocin nasal spray. So I will report back what my response is. So people have asked in the chat, what about peptides for weight loss? And to be honest, Jill, I'm not even sure what inspired you to get me on Sermorelin. I think back in the day, though, it was ipamorelin or whatever, before Sermorelin with glycine. But all I can say is, y'all, she suggested that I try it, that it would give me energy. And I'm like, but I already have energy. I think maybe I was complaining about not having motivation to work out very much. Because after the lockdown in France, or during the lockdown in France, we were not allowed to go more than 1 kilometer away from home. And my fitness routine involves going about 5 to 8K along the sea and up to the old town. So I put on weight, and I also became like less motivated to exercise. So I don't know what it was that you saw or why you encouraged me to try it. But I remember calling you up. I'm like, girl, what is going on? Like, I'm dropping weight. My clothes don't fit. I literally had to go buy new clothes. And then when you and I should show the picture, when you and I were on the beach in Costa Rica just a few months ago, I'm like, what is going on? So tell us more. What's the difference between sermorelin and ipamorelin or whatever?
Yeah. So as you know, science is, it's always improving. And so there's different formulations. And the original way that we had to boost growth hormone was HGH, or growth hormone. And that's something that I did use in the past. It's great. It
So
works
did
really
I.
quickly. But it shuts down your own production, and it only has that one effect. And it has kind of a narrow therapeutic window. So too much is more is not always better
Right.
with any of this stuff. But too much growth hormone can cause like your organs to grow, which when your heart gets bigger, in a theoretical sense, it's great, like more love. Like in an actual sense, it does not get stronger. You can get like the Cro-Magnon look with your forehead growing as well. So they started looking at other things, and peptides are chains of amino acids that occur naturally in our bodies, and they were able to compound these to be bioidentical. So they literally match our body. So our body's like, oh, I recognize that. I'm gonna, make that a little bit more. But they're pleiotropic, so they actually like will not just target the one symptom. They have multiple benefits, and they don't shut down your own production. They enhance your own production, which is we want our body to work better for us. And so as they've gone along with this process, they've developed, the first one we had was sermorelin only in a sublingual, and it was okay. And that was all we had. But then as they continued improving, they found that injectable was better with absorption and actually did move the needle a little bit more on the number scale, but more, like I said, symptomatic. And then they added the glycine component, which helps with mental clarity and focus. And then previously, in between there was the ipamorelin, which is just another variation. And some people love that. Other people, find the sermorelin to be better. And that in combination with something called CJC actually helps with sleep. So we can talk about that later. But when they combined the sermorelin with the glycine in an injectable form, it really accelerated the process for people. So patients were letting me know within the first month that they were literally shredded in their visceral fat area. And it's not just for looks. I mean, visceral fat is the most dangerous fat that we can have. It increases our risk for heart disease, which is the number one killer for women and men. And the conversation was in Iceland when you're like, I have this extra. Um, and it was the COVID weight, because even though we're wellness doctors, we still have stress and our body responds to it. And we're not like
And I was in
immune to
lockdown.
that.
Like
Yeah.
France was in a prolonged lockdown. So getting
Yeah. And
exercise.
I even had gained as well. And then it worked super quickly for you within like a month. I remember you saying like, I need new jeans, like nothing's fitting. And I'm like, sorry, not sorry. But it works really quickly. And then, you'll need less and less of it as you go along, because as you lean out, your body requires a lower dose. So that's another thing that's really important for people to know is like, if you've been on the same dose of thyroid or some other medication for 5 years, one, you're not listening to your body, which is so important to listen to your body. And two, your doctor's not really listening to you and your body.
Mm,
And sometimes, as we mentioned before, like we don't even know what our body's telling us. We don't know until we hear from other people like, oh, I thought that was just part of the whole process. I didn't realize like I wasn't supposed to feel that way.
yeah.
Um, so that's how the Sermorelin works. It's not just for fat loss, and it's not just visceral fat. It works for fat reduction all over and helps with lean muscle mass. So that's our like healthy muscle,
Mm.
and it works very quickly for men and for women.
Yeah, I definitely noticed that. And as I did more research, I was happy to know that it doesn't shut down my own growth hormone production. So it's these little peptides go to the brain and say, hey, crank out some growth hormone, IGF-1, insulin-like growth factor. And so for anyone who is curious, it is still wise to eat properly. I didn't go on any special diet. I'm vegan and I eat healthy all the time anyway. But one thing that you should know is that when insulin like growth factor is around, which is growth hormone, it's insulin like. So if you go and eat a big carby meal and you have insulin come on the scene, insulin is going to compete. So if you're taking this peptide or growth hormone itself, you're not going to get the great effect. So just a little wisdom for some of you out there. So all right, so we've talked about fat loss and building up lean body mass or lean muscles, which definitely is working for me. The other peptide that I was really skeptical about was BPC 157. And it wasn't until I really started doing the research because, y'all, Jill was here. She was with me in Monte Carlo with her lovely daughter. And we spent, a few days just enjoying New Year's. But as I was sitting in kind of a funny position and I had this neck pain. And, Jill's like, want me to inject you? I'm exaggerating, but it was almost like that. She's like, I have my BPC with me. And I'm like, so it's not really painful. It's just because I'm sitting in a funny way, sleeping in, a hotel. But as I started looking at it, I was like, oh my gosh, there's so much research out there about BPC decreasing pain, inflammation, improving like muscle and tendon injuries, and also the gut. Like I saw reports about BPC being used for leaky gut, for Crohn's disease. So I was like, okay, it's like you say, it's this pleiotropic effect. It has multiple effects on us. So talk to me about your experience with BPC. And now I'm a convert, y'all. I just got back from America with my bottle of BPC and doing my injection. I'll tell you about my results later.
We're like mad scientists. Let me inject you. Thank you for the trust. I appreciate it. So BPC 157 is amazing. I love it personally and professionally. It stands for Body Protection Compound 157. I don't really know the reason for the 157, but it's available in an injectable and oral form, and it reduces inflammation, pain. And inflammation is at the base of so many different diseases, but I've used it myself and with people who have specific injuries, and it works immediately within just like 1 to 2 injections. It's amazing. I've also used it for patients that are, potentially looking at having surgery. I had one man who I think he's 52 or 53. He has a congenital hip condition where he's had a hip replacement before, and he was looking at having to have another one. And I was like, well, hold on, let's try this. And he's like, this has completely changed my quality of life. I no longer have to have the surgery. It really is amazing. I also had a 38-year-old woman who was supposed to have a foot surgery. She had some inflammation from running and was not able to do her normal routine. And she got to cancel her surgery because it took care of the inflammation. So it really is amazing, not just for, the aches and pains, but ultimately it's reducing body inflammation. So Stress causes inflammation, and inflammation increases our risk for heart disease, Alzheimer's disease, depression, cancer. When it's given in an oral form, it actually can help with people who have any type of like reflux, inflammatory bowel disease, those kind of things as well. If it's given in injectable form, theoretically, it's still reducing the inflammation, but it doesn't necessarily hit the symptoms as quickly as when given in an oral form. But it really is amazing. It's also helpful for people with autoimmune conditions, which ultimately is low level inflammation. I've also used it for perioperative care, pre and post-operative care for people who were having, cosmetic procedures or orthopedic procedures. And it significantly reduced their downtime. So it improved their recovery time, reduced the amount of pain that they had. People were, their doctors were like, "What are you doing?" Because they recovered so quickly. It also stimulates collagen production and the fibroblasts with the ligaments and tendons. So specifically for orthopedic, but like I said, I've used it in people who were having other types of surgeries, whether they were female surgeries, cosmetic surgeries, and if it's given, perioperatively, like a week or so before a surgery and then afterwards, it significantly decreases the amount of pain and inflammation they have. However, I've had some people that I didn't see them until, maybe a month or two after their surgery. They were still having some residual inflammation, which you can have up to like 6 months to a year, depending on the surgery. And it still helped reduce the amount of pain and improved their healing time. So you can use it on a routine basis, which is what I recommend, or you can use it on just a targeted basis for injuries as well.
Well, what was really impressive to me about that was Jill injected me, I think, 2 or 3 times before you left Monaco. And what I initially noticed was the tension in this muscle group decreased. And what I actually noticed was more pain. But it was like when you've been stressed or tense for so long and the muscles finally relax that you can feel that the muscles were in pain all along. And over time, it's just gotten less and less and less. And I'm like, I have no idea. You and I have talked about this. It's probably some psychological part of me that was amped up. But what's been interesting is that now that it's relaxed and the pain is gone, I feel like I'm able to do some exercises that I wasn't really motivated to do in the past. So I'm grateful for that. And we'll see. We'll see what happens next. So we had some other questions in the chat around energy levels and fatigue. So Shaf said that getting sleep has helped, but she's still feeling her energy is low. And somebody else previously asked about that. We talked about the sermorelin that your compounding pharmacy creates, which adds glycine for a little more focus and clarity. But what else would you recommend for increased energy?
Yeah, and the sermorelin and the pamorelin both boosting the IGF-1 increases your energy. Also, just increases that overall feeling of well-being. But another one that I use for energy and focus clarity is called C-Max, and this is a nasal spray. It can come in an injectable form too. It just depends on the state that allows it. And the nasal spray is a little bit quicker acting. And the way that this works, you'll love, is it actually stimulates and increases BDNF, which is brain-derived neurotrophic factor, which is seen for neuroplasticity or neuroregeneration. So it's helping to kind of rewire some of our neurons and also activate them. And the reason I love this one is it's not just for like that energy and that focus. It actually reduces your risk for Alzheimer's disease and dementia. And then again, because of that neuroplasticity, it helps process trauma. It helps with creativity. And also, in this day and age, Adderall is given out quite frequently. People are diagnosed with ADHD a lot, and because it's a easier diagnosis. In traditional medicine, we only have a short amount of time, and we look at in the box diagnosis, quick fixes, and that one's a quick fix. And so Adderall is literally just it's a stimulant that's not preventing anything. It's actually like flogging your adrenals even more. But this peptide in particular, I'm able to get people off of their Adderall, and they have that focus, and they don't really have ADHD. ADHD is just a symptom, and it's also like a wastebasket diagnosis. What's the real issue there? And one of the things that we both talk about is trauma, and most doctors don't ask in their medical history, like, what kind of trauma have you suffered in your life, like what the ACEs score that we talk about as well. That's just like nowhere in their armamentarium, and it's something that just to look at the whole person, you really have to look at all of that, because all of these symptoms are messages that our body's sending us, like, hey, there's something going on. So the CMAX nasal spray it's a quick fix, and it's helping to reduce risk of other diseases.
Well, I want that one next, please. I mean, it's no secret that my mother uh, suffered with dementia. Um, Many people in her family, on her side of the family, had and have cognitive decline, and some of my cousins have even shown full-on dementia as early as their 40s. Now, my mom was able to stave it off with a healthy lifestyle and, exercise and what have you, self-care. She didn't show signs of cognitive decline until her 70s. So for me, I'm doing everything absolutely possible except for cryotherapy. I'm not jumping in the sea, no, when it's cold. Um, Sorry, but everything else, like meditation and qigong and self-care and proper nutrition and sleep and hydration, like I'm doing the maximum. But one of the things that you talked about with CMAX and also with oxytocin, I'm curious about, because as both of us are now offering psychedelic assisted therapy, whether that's with ketamine or when FDA approved MDMA and psilocybin, we know that with ketamine, which is it has psychedelic-like effects, but it's a dissociative anesthetic. We know that it's opening up these windows of neuroplasticity. You mentioned BDNF, and we know that the other classic psychedelics do increase this neuroplasticity. And so what I'm curious about is adding some of these things in, either, as you said, maybe giving oxytocin with a ketamine dose, or in the post or the in between sessions when you're doing integration work, because we can take advantage of that neuroplasticity as we're integrating what downloads and visions we've seen when we've been sitting in these sacred medicine ceremonies. So I'm curious about the CMAX, because great for the Alzheimer's stuff, absolutely, but if it's also helping with creativity and neural pathways, I mean, you know me, I'm a big believer. So that sounds really cool.
Yeah. And it's also a great alternative for people who are a little bit hesitant about psychedelics. It's something, that you can absolutely use with it. But for people who are like, I don't know if I want to do that and be altered, the CMAX doesn't alter you at all. It just like turns you on, like, okay, I'm ready to focus and get things done, but it doesn't alter your thoughts or your personality or your ability to drive or anything like that. But yeah, all of those things. Actually have been incorporating with some of my ketamine clients, and more to be revealed on their unfolding.
Yeah. Well, it's an exciting time for us. For those of you that are interested, visit innatevitality.com and you can learn more about psychedelics and upcoming retreats and workshops that Jill and I will be doing with and without psychedelic substances. So if you want to experience these expanded, non-ordinary states of consciousness where you can process trauma and really tune into life purpose and all of that good stuff. Jill and I will be facilitating some workshops along with another lovely physician, Dr. Corina Fratila. So definitely stay tuned for that. All right, so Jill, what else do we need to cover in terms of peptides? And somebody did send in a question about DHEA, which typically falls under more of our conversation around hormones. But what
Mhm.
other peptides do we need to cover before we move on?
Those are the main ones that I use right now. There are other ones. There's a ton of different ones. There's one specific for like hair growth. Um, there's ones for autoimmune processes, like in a little bit more targeted, targeting the T cells. I don't really work with a lot of that in particular. A lot of people with autoimmune processes. I do have a couple people that have had some autoimmune things that have been kicked up because of the pandemic, and whether they are vaccine related or actual, the process related, is still up for debate, but it's been helpful in reducing their inflammation. So I use those, and those kind of go in and out of what the FDA is allowing or choosing to use for themselves. Um, there's ones that stimulate testosterone on its own. However, the effect of it is not as robust as direct testosterone supplementation. Um, there's so many out there, but those are the main ones I use. The CJC with the ephemerelin, I use quite frequently as well for people who suffer from insomnia or difficulty falling asleep or staying asleep. And this one works amazing as well. It boosts that IGF-1 production, which is our natural feel-good hormone, but it helps you to get into that deep REM sleep where we restore our bodies and minds and everything. So and that's something that happens as we age. I remember, I when I started my hormone journey, I think I was like 38, and I just couldn't sleep, and I didn't realize that that was part of hormone imbalance. Um, and so I initially thought the only thing available was things like Ambien, Lunesta, and I took those and they worked, but they have side effects too, that I saw in my patients. And I was fortunate enough to, have just started training in this field, and it was lack of progesterone actually was causing that imbalance. And so just adding that to my armamentarium helped with the sleep. But then, um, that helped. And then I hit a plateau where I'm still having trouble sleeping. So I had to add the CJC as well. And that was amazing. So that's why it's really important to listen to your body's messages, because you're going to need different things as you age, as you shift, as you change your diet, all of those things. So, and that's okay. We're dynamic beings. So, being able to communicate with your practitioner is super important. Don't think like, oh, I feel like I'm complaining. You are a dynamic being. You're allowed to change and shift and need different things. I'm so glad my practitioner she's trained by the A4M. And so I'm able to have a conversation with her and say, like, I think this is what I need, and I'm open to, hearing her perspective too, because our trainings are a little bit different.
Mm.
Whereas the old version, people would have just been put on like Premarin and Prempro and no talk of peptides, which that's just, or birth control. Like people will just put on birth control. And we're not one size fit all. We
No.
definitely deserve to have customized treatment. So,
Yeah,
and I
I'm.
thank you for being open and willing, because I know as an informed, practitioner yourself, it is hard to kind of like, well, I was taught one way and now this new thing, let me see the data and I'm not sure. And it's like unraveling that whole like old paradigm of what we were taught. Well, that's normal, versus optimal. And it's being able to be open to those new ideas. So thank you for being open.
Absolutely. I mean, as I said in the opening, my conversation with Dr. Mintz was like an eye opener, and it set me on the path. I think when I became pregnant with my daughter, I decided to just go all natural and just kind of felt like, "Oh, I don't need to be optimized. I'm like in mommy mode." So, and of course, also coming to France, where there are very few people practicing age management medicine, it's like they just look at you like you're over 40. Of course, your thyroid is low. Of course, you feel tired. It's like, it was so frustrating for me. So let's talk about DHEA since someone did send in this
Yeah.
question. Because you've mentioned testosterone for women and taking using DHEA, whether that's a cream, whether that's intravaginal, can also get at producing testosterone for women.
Mhm.
It's something that I did mention in this book here, the orgasm prescription for women. In that book, I talk about the ways that one can rejuvenate the vagina because as your hormones decrease, you're going to need some rejuvenation there so that you can stay enjoying the sexual activity. So talk to me about all of the various ways that you have seen DHEA help women and how long does it take typically to see the effects?
Yeah, so DHEA is actually secreted by our adrenal glands, which are the little glands that sit on top of the kidneys. They also secrete our cortisol and our testosterone. So it is a real thing when people are like, I'm stressed and tired and have no sex drive because your own production has been shut down. So doing things like meditation actually gives your adrenals a bath. And getting good rest, things like that, following the anti inflammatory diet that you spoke about earlier. It's going to help your own absorption. And as we age, that's not enough. We need supplementation. And so DHA has benefits with anti-aging of the skin, soul, helps build collagen, also helps with like skin texture and tone, and it's a building block for testosterone too. So it's important to optimize both. It's given in two different forms: an oral form, which can help with the lean muscle mass, the fat loss, the collagen production. Um, and so that's one way to boost it. And it works pretty quickly. People notice a difference within the first week. But it can also be given in addition to the oral, it can be given in a vaginal cream or suppository to help with the juiciness of the vagina and also with like the surrounding structures because, you know, all of our skin starts to sag a little bit as we age. And so you may, you know, women may notice that things are shifting down there. And I've had women that were embarrassed to talk about it until I actually just said, like, you may notice things have shifted. They don't look the same. It's like a wrinkly raisin, or shriveled up. And also if you have your lubrication, you know, next to the bed or like multiple lubrications, that's a sign like, hey, there's something going on. And then when you get what we call atrophic vaginitis or thinning of the skin down there, you get less lubrication. Intercourse or sex can be more painful. And you can get these like micro tears in the skin that can lead you to develop more yeast infections, more UTIs. And ultimately, like every time it tears, and then when it's healing, it can create scar tissue. So it's not just, you know, for sex, it's actually to improve like your overall function. And then you also lose sensitivity, you lose the lubrication, and you lose the ability to have an orgasm. So the DHEA hits all of those components. It helps with increasing the sensitivity, the quality of your orgasm as well as the quantity, and then also helps with your inner vitality. So it hits all of those parts, and some people notice within just one time of using it. Other people, it can take up to like a week or so. And the nice thing about this is for people that are, you know, not quite on board with taking oral hormones, this doesn't get absorbed systemically. So it can actually be used for women who have had breast cancer, or any other type of cancer, and they don't want to take oral hormones. So it can be given that way and not be absorbed systemically.
Well, this has been really helpful. It seems like some people in the chat have been grateful to get this insight and information, stuff that many people have not even heard of. And of course, we have people from multiple countries here. So I know the frustration of many of people in the UK who have said that the NHS doesn't go for all of this extensive testing and the lab work and some of these hormones, which I find really frustrating. Because I'm like, if I didn't have access to the vitality that I have now, I don't know what my life would be like. Because, being able to start on this, doing this fellowship in psychedelic assisted therapy and starting yet another company and traveling the world and just feeling like I am truly living my best life. So I think between the hormones, the peptides, and of course, sitting in ceremony with psychedelics like magic mushrooms and ayahuasca, and soon for me, it will be ketamine as well when I get to the US next. But I just can't imagine having to just suck it up and live a mediocre life. So I thank you once again.
Thank you for helping expand my vision of what life can be as well, and pursuing all of these, and speaking about all of these things, because more awareness is needed. And as I mentioned, I couldn't even speak before. And that was partly, just a lot of people have fear of public speaking, and partly that was trauma, which has subsequently been released. And now I can shout from the rooftops. And I also, just really quick, I'm able to try new things because of you, because of these peptides, because of these like mind-opening things. And so I actually just participated in a webinar that is going to be, or a summit that's being released on Saturday, so people can join. With the link. It's free, and it's starting dance as an adult. And dance for me has become a way of activating that like inner vitality, that Shakti energy, and also moving energy. Something we've done together before,
Yes.
the TRE. People should look this up if you have any trauma in your body from childhood or adulthood. Traumarecovery.com. But trauma releasing exercises really help to release trauma from your body. So, like when a gazelle is being chased by a tiger, they go into this shaking mode until they discharge that fight or flight. And then they just leap up and go. And that's what we can do as well. And for me, dance does that. And it helps get me in tune with my own rhythm, and fire up my own energy. I do it every day. You don't have to go somewhere to dance. You can do it anywhere. So yeah.
Yeah, well, I've put your website, drjillstalker.com. So if you guys go there, you'll see different ways that you can sign up for her newsletter, and she'll send you the info about this new summit, about tuning into the passion and the energy of dance. I think we could also have another live conversation about all the various ways that you and I have treated trauma. Me, myself personally, the things that I have done to overcome some of the adverse childhood experiences and growing up with a toxic, dysfunctional family environment for many years, because it wasn't your straight ahead trauma therapies that got me to where I am today. So I think we could share a lot about that, especially as you're doing your work with Dr. Gabor Mate in his Compassionate Inquiry program. I think there's so much that we could share there as well.
Absolutely. And it's because of you sharing your story, 4 or 5 years ago, openly on Facebook, when I was just like, oh my gosh, a doctor, someone is sharing about this like publicly, and she's a doctor. And that's just not anything I had ever seen modeled to me. And because of that, I'm able to be on here with you and to share about trauma, and all the things like they're all related, and there's, yeah. So I'm very grateful. Yes, Dr. Gabor Mate is amazing. And I'm doing a year-long training with him in his compassionate inquiry technique. And that is something that I didn't have modeled to me until I met you, was compassion. And, your meditations and insight timer and workshops in there are have just really spoken to my heart and helped me, to follow that path, to really want to learn how to do that, because I would feel stuck on how to do that with people, because it's so important when we go through any of our journeys, whether they're psychedelic or hormonal. If you don't have an integration, a way to be able to speak to somebody, it's not, what Dr. Gabor, what he talks about is trauma is not what happened to you. It's, being alone with that. And also then you're shrinking, and the constriction that happens with it. So being able to have somebody who's attuned with you, and you, the attunement process master on your insight timer, modeled that first to me. And yeah, I think more people need that in their overall journeys, psychedelic, hormonal life journeys.
Absolutely. Compassion and meditation for me was a game changer when I came out of that type A, aggressive, compulsive need to prove myself energy. It was a big transition. Like, the person I am today is nothing like who I was before my daughter was born. The year of my, like, spiritual awakening was 2005, and that's where everything shifted for me. So much more to explore. Jill, thank you so much. Thank you for all of the love, the
Thank
support,
you.
the friendship, and being my partner in elevating consciousness now in all the things that we're going to be doing together. I'm just super grateful.
As am I. Thank you for everything, for all of it.
Yes, amen. And we're just getting started, y'all. So watch this space.
Yeah.
So there you have it, my friends. I hope that this was informative and that you learned a little bit more about your vitality and the possibilities for you to advocate for yourself with your physician. And check Jill out online, drjillstocker.com. Check me out at andreapennington.com. And yeah, I look forward to having another conversation around trauma and, of course, more about psychedelics. But until we meet again, remember this, my dear friend: you are a gift to the world. So share your presence with passion. Much love, Jill. Much love, everyone. Bye.